All right, so here's the official welcome to Alcohol Trends. We are very happy that people are here. I think some people looked at the beautiful weather outside and said, not doing it, but that's okay. We understand. And we've got a nice group of people, about 7 people online and a few folks still coming on. So that's really good. And we've got one person here in the room besides me, so that's super duper. And we'll just kind of go ahead and introduce ourselves as presenters first. My name is Kathy Schwartzhoff, and I am one of the mentoring coordinators here at Helping Services. And I'm having a little bit of a concern because there we go. Whoops, I went too far ahead there. My PowerPoint wasn't advancing. So a little bit about me. I have been at Helping Services. It will be 31 years as of June 1st. That's full time. And I've done some part-time work before that at Helping Services. And I've been a mentoring coordinator for 25 years and a certified prevention specialist for 27 years. So other things you need to know is I have a husband and 3 children, 4 grandchildren, all proud of all of them. I enjoy gardening a lot and being with family and friends. So that's a bit about me. Dan, what would you like to share?
Well, first of all, I'm sorry I've been in and out here. My internet connection has been dicey, and so I'm glad I'm back here. But yeah, no, thank you. Dan Marx, 26th year in law enforcement and 9th year as county sheriff. And I don't know how many of these trainings that Kathy and I have done together, but it's been a few, and happy to be on it again.
Yes, I think this is the 3rd one we've done together.
I think that sounds about right. Yeah.
Yep. So, okay, so just some housekeeping things. This tonight is going to be very interactive. There will be times where we will ask you some questions, some facts and fiction type of thing. We're also going to have you think a little bit about a first time that you drank alcohol and kind of what your parents' rules were related to that. So we want you to ask questions. We want you to be in charge of your own learning and learn. We will learn together because I learn as much from these trainings as you all do. So that's a great thing. So folks who are online, we ask that you mute right now, but then unmute when you have things to say. You also can put things in the chat, and Sam will be helping me read that since I can't see it from my perspective here. One thing that's really important is there is some information that I want to get to you that I have not sent yet. It's part of the presentation, and I want to be sure that everyone gets it. So go ahead and put your information in the chat. There's some folders back there and a little sign-in sheet. Okay. Yeah, we just had some people walk in. So, and help yourself to treats. Do you guys have treats online? I hope so. But as I was saying, we want to be sure that we get you the added information. So put your email in the chat and I'll be sure and get that. If you pre-registered, I have it already, but I think there's a few people that may not have pre-registered that it would be great to get your contact information. And then too, we will be sending you the recording. So you get lots of good stuff. One thing I will say is this topic is so huge to talk about alcohol trends. And we really had to narrow it down because we want to keep it to an hour so that no one's snoring at the end or anything. And we want this to be a learning process, but also a process that we're all visiting and talking. So first of all, we're going to talk about how it's related to youth mentoring. Looking at Iowa and national use rates, and then 2, what trends there are for youth specific to the counties that we serve. Looking at some product and lifestyle trends that you may or may not know about. It was interesting when Sam did this earlier in the month. Some of our substance our prevention specialists didn't know some of the information. So that was really good to have that chime in there. And then two, we'll be visiting about laws and statistics. And I have to say, my favorite part is always to talk about how can we help others, either ourselves if we've got concerns, or loved ones, friends that you may be concerned about. At any point, ask questions, make comments. We do want to keep it to an hour, so there may be times that we'll have the conversation slow down a bit, but we want you all to be sitting with us. So that's where we're headed. And first off, with youth mentoring, some of you are very familiar with mentoring and others aren't. And the basics, youth in our program are between 6 and 17. We have 8 program goals, and a couple of them that are very important are that we want the youth to have a positive future. We also want them to make good decisions related to alcohol, tobacco, and other drugs, and to realize the impact of problem gambling. Those are 3 that are certainly in the very prominent part of things. And we're always looking for more mentors. I am going to ask Sam Howell, who is our Delaware and Southern Fayette mentoring coordinator, to just chat a little bit more about what anything more that she wants us to know about youth mentoring, because I just gave a quick overview.
Yes. Hopefully you don't hear my little one yelling in the background. Sorry if you guys do. I promise he's okay. He's in the bathtub with grandma. Yes, I just wanted to kind of add to that. Like Kathy said, we serve ages 6 to 17, and that is by connecting them with a trusted adult to help them thrive. We are in 6 counties now. So we're in Howard, Almaquee, Winneshiek, Clayton, Southern Fayette County, and Delaware. To be a mentor is really simple. We ask for 4 hours a month and at least 1 year commitment. We hope that they love it and they love their match and they want to stay with them until that child ages out of the program at 17. And we are looking for, families, couples, especially males. We are always looking for males to join and be a mentor. And I just wanted to thank you all for joining us today for our last training of the fiscal year, not the whole year, but a little happy dance there. And I'm going to turn this back over to Kathy and Dan so that we can get some knowledge for this next hour.
Yep. And one thing I wanted to share too, if you're not from the counties that Sam listed, the second link is the Iowa Mentoring Partnership, and you can look up by county or by city to find a program. So encourage you to do that. And if this slide doesn't show up that much, you can catch it when you get the recording. So moving right along, we want to look at the Iowans use rates. And here it shows us in this quote about 53% of Iowans report drinking in the past month, and most see them as recreation, but there's 22% who binge drink, which is quite excessive. So, and that 22% of those binge drinkers in 2020, that was over the average, the national average. What do y'all think of that? Does that surprise you for the entire state and comparing it to the national thing? Or what comments or aha moments do you guys have? The room is very quiet. There's my
I would say, Kathy, that I think Iowa, and it's been good in some ways. I want to be fair on both sides. I think Iowa's definitely kind of made a name for itself for being the beer state. And you take it up here in Northeast Iowa, per capita for the amount of breweries that we have and things like that, I think it even is more so per capita. It's probably the most in the state of Iowa. And again, I want to be careful. I don't want to just make cliche comments. I don't think it's all bad. I think it's been good in a lot of ways. It's been good for economy. It's been good for recreation. It's been good for tourism. And I think a lot of people enjoy it. And a lot of people handle it responsibly. Unfortunately, a few people don't. And therein lies the problem.
Yep. Yes. Thank you. Any additional comments?
I just want to add online, Allison and John put not surprising. And whoever has the name Deal Home, I'm unsure who this person is. If you want to put your name in the chat, that would be helpful. But
Yeah,
they put not plenty high.
Gotcha. Great. Okay. So some more information about Iowans. According to the National Survey on Drug Use and Health, the average for the last 5 years for Iowans who are binge drinking has been above the national average. So it's not just, oh, that just happened 1 year or something like that. It's been consistent. And also there are harms related to excessive drinking, including more cases of liver disease or cirrhosis, alcohol-related deaths, car crashes, lost work time, suicide, and alcohol-impaired driving. And then two, with abusing alcohol for adults at the rate of 20%, those impacts of the abuse go beyond the user. It's friends, family, coworkers, someone you meet on the road, just a lot of impacts, and they can be lifelong type of concerns if they're not addressed. And then this is a big number. 1.9 billion is the cost of those drinking excessively. And that includes lost productivity at work, healthcare costs, criminal justice costs, motor vehicle crashes, property damage, and it breaks down to $1.59 per drink and $635 per person. That's a huge cost. That hurts my wallet. So yes, and again, those alcohol-related deaths have doubled, and that's just really in the past decade. And we've already talked about some of those harms that are related to that. And then looking at alcohol consumption by state, just some things that are really interesting is we see that Iowans consume 36.4 gallons per capita. And to give you a sense of the highest state is New Hampshire. And I sure would like to know why. That surprises me. They're so small. They're at 59.5 gallons. That's a lot. Almost 60. And the lowest rate, that one doesn't surprise me, is Utah, because I think with the faith-based organization that may make a big impact. And kind of mirroring what Dan said too, Iowa ranks 11 highest in the US in drinking beer and the 5th highest in the US, so for alcohol consumption. And then two, that binge drinking is really a big concern. The state with the highest percentage of binge drinking is Kentucky with 9.5%. Second is West Virginia with 9.4%. And I think of this, it's a point difference, which is really interesting. Iowa ties with Hawaii and Kentucky at 9.1. So like Dan said, we're kind of famous, but I'm not sure that that's what we want it to be famous for. And we know that binge drinking isn't being an entertainment type of thing. It goes beyond that. So a national trend that I found very interesting is that from 2020 to 2022, underage drinking for those 12 to 20, the rate of underage drinking actually declined. And so that was good. I said that wrong. From 2020 2002, say it better, and 2022 that actually declined. And part of that was COVID times. But interesting information to know that that declined. So, okay, we've used some terms that may not be familiar to everybody, but we're gonna see what you think about this. This is a fact or fiction. And we're just gonna read this statement, and then when you realize it's either fact or fiction, put it in the chat or unmute, or you guys shout it out in the group. Excessive drinking is when you get drunk more than once a week. What do y'all think? We're seeing false. I don't know, and let's wait in the room. So it is fiction. And like I said, I've been using some terms already, so I want to define those. So binge drinking is how much a person drinks at one event. And for women, it's 4 or more drinks. And for men, it's 5 or more drinks. The other heavy drinking is how much a person drinks during a whole week. And so for women, it's 8 or more. And for men, it's 15. And when we saw that term excessive drinking, that includes both binge drinking and heavy drinking. So it's kind of good to know that there are different terms that have specific information related to them. Does that make sense? Okay. Now we're going to look at youth use rates and a little bit about the Iowa Youth Survey. Some of you who have been to trainings before have heard of that, but just to remind, and for folks that haven't heard it, the Iowa Youth Survey has usually been done every 2 years, and 2021 was the last time it was done, and then the legislature and our governor said we're not going to ask youth to comment on things and take things like this in schools for now. And so that's unfortunate because this is the last data we have. And it's good to know what youth are thinking, and you'll see some of the things that we got from that survey that helps us to better understand. So first of all, this question asks the youth, and back up a little bit too, the youth that are asked are in 6th grade, 8th grade, and 11th grade. So they were asked, how have you drank in the last 30 days? So the blue bar here is 1 drink, the red bar is 5 or more, green is beer, and the others other alcohol. One thing to really look at is the far right set of bars shows what the state averages are. And that's always a good thing to look at to compare where are we at compared to the rest of the state. And you can see we are pretty high in most of the counties. And one thing you may note too is that Sam talked about we serve Howard County, and Howard County, the schools can opt out of taking the Iowa Youth Survey, and school districts in Howard County opted out in 2021, just coming out of COVID. They may not have felt like they could do that. So it's really good to just kind of look at this and see that youth are in our area are using quite a bit. And I love this quote that's on here. It says, each of our service area counties are at a higher rate than the state when it comes to drinking 1 drink of alcohol, and at a higher rate than the state for 5 or more. And just to tell you too, they are not asked what, in the past 30 days, have you sipped? It's in the last 30 days, have you drank a drink of alcohol, beer, wine, any kind of. And another thing that I think is kind of interesting with this too is in years past, the other alcohol bar has been quite a bit lower. And we probably know now that there are many products that, how can we say, make the taste less abrasive is the way I can say it. And youth are tolerating that better and drinking more than they used to. And probably some adults are too, related to that. And then one thing that is really important with youth is if they have access and they can get the alcohol, they're going to try it. If they can't get at it, the corner convenience store doesn't sell to them, then it'll be harder for them to use alcohol. So it's always good to look to see. These youth were asked, is it easy or very easy to get alcohol in your county? The state rate is at 48%, and every single one of our counties is above that. Some of them really above that. So access is something that is very important in preventing youth to use. And then too, I always like to know when are you starting to use, and these 6th, 8th, and 11th graders were asked, when was the first time that you ever took an actual drink of any kind of alcoholic beverage? And look at how big it is at 8 and younger. And that's too where we need to make sure in our school systems and in our family systems that we're talking to those young kids about what's out there and the choices they make and their family rules and that kind of thing. But too, looking at 15 to 16-year-olds, they're really high up there. That doesn't particularly surprise me because it is kind of that teenager type of rebelliousness that can happen. And thinking that this is the first time for them. And we're going to move right into some product trends. If anybody has any questions or thoughts related to youth use, we would entertain those as well. But a product that I didn't know about before this, it's called a board. And boards stand for, it's BORG, Blackout Rage Gallon. And you can see in the lower left-hand corner, there looks like a gallon jug that is being reused. Well, that's exactly what it is. And what's in there is some type of alcohol, usually vodka, because it's not as, well, it doesn't have a lot of taste. And then the maker of the board puts in some kind of product that liquid drink that has electrolytes in it. And the rationale for that is because it helps with the hangover, and or you won't have a hangover or less of a hangover. And the other thing too is it adds flavor, or often can add flavor. And so this became popular in 2020, 2022, especially Gen Z folks who were watching TikTok came about there. And young people have been doing boards for a while and find it an alternative to what they've used before. And that's always exciting to young people to try something new, and especially if they kind of go outside the norm of something, that's always exciting. Another thing that we found in researching this, and Sam was great at researching these new things, was functional drinks. And functional drinks are a conventional liquid food or drink, really, that is marketed to be a specific product ingredient that's supposed to have some type of health benefit. And you can see on these cans of the elements, that's the brand, that the dark blue one could help you with sleep, and the yellow one could help you with vitality and that kind of thing. So a person uses a functional drink to help them feel better. And they can be dairy beverages, sports and performance drinks, energy drinks, ready-to-drink teas, smart drinks, fortified fruit drinks, plant milks, and enhanced water. So those all are considered functional drinks. They do not have alcohol in them, but they do have vitamins, minerals, amino acids, dietary fibers, probiotics, and sometimes added raw fruits. And it's just something new that I hadn't heard that term. I'd seen some of the products, but I hadn't seen that term. So that was something that was new. And then too, these alcoholic drinks, just kind of look at these a second and see if you were a teenager, would you be kind of attracted to these? I mean, who doesn't want to be a beast or drink a beast? I mean, you know, and then the artwork on that one to the far top left is just pretty remarkable. And then too, sometimes these drinks that are being marketed to young people mimic an already non-alcoholic beverage like Lipton iced tea. I drink iced tea quite a bit, but I don't drink hard iced tea. And then Sunny D, you know, your first look might be like, oh, good, he's drinking some orange juice. Isn't that nice? And then when you see the vodka seltzer, you can be like, oh, this is a concern. And then the Arnold Palmer, that packaging looks like Comet container to me. So anyway, these are just things to be aware of and to read labels and look at what is in the alcohol section, and particularly at convenience stores, they often have their end caps have different products that you can look at to see what's out there, what's being purchased, and they put it right next to or very close to the cashier's area so that someone can just grab it as they're heading out the door. So just be aware of these products. Okay, we've got another fact or fiction. Here we go with the law. The penalties for the first offense of a person or persons under legal age who purchase or attempt to purchase, consume, or have alcoholic products in their possession or control are charged with a simple misdemeanor and a fine of $200. What do you think? They think it's higher here in the room.
We got lots of fact online.
Okay, and it's really close. It's $260. Now, I really want to know how they came up with that, because what's $260? For the second offense, it's $500, an even amount, but look at that, that's a lot of cash. And third offense and subsequent ones, it's $500, as well as having your license suspended for a year. So pretty hefty for possession. So, okay. Interesting. So we learned something new with that one.
And I would add to that, Kathy, that actually oops, that's not what I want to do. I would add to that, Kathy, that actually the fine is higher. I mean, the fine you presented is correct, but by the time you tack on surcharges and court costs and all that, that's not what they end up paying. So the fine is absolutely spot on what you said, but they pay significantly more than that.
Wow, that's very interesting to know that. Thank you. Good deal.
Kathy, I just want to know also, do they have then, is there like counseling services for these kids? How is it done nowadays?
Some systems or counties have a class that you have to take that they can actually have their first offense waived, not on their record, but it depends on what's available and if it's offered in their county. But Dan, what else can you share about that?
Yeah, I that's how I understand it as well, Kathy. So you really have two, it's whether it's charged as a referral or it's charged, so it's really over 18 and under 18. I'll shorten that down a little bit. If it's a referral, it goes through the juvenile court system and there actually isn't a fine at all. It's just a juvenile referral. And that's a good question what they do. To be honest with you, unfortunately in the juvenile system, not much from what I've seen. At over 18, that's where the diversion program comes in more, at 18 to 21, where if they take a class and meet certain criteria, it goes away if it's a first offense. I'm sorry, I can't talk a little more intelligently on the juvenile side of it, but we don't really have a lot to do with that. That's kind of a whole separate system. We make the referral and they take it from there. So,
And then the other piece to that is school systems have a violation of their code, their conduct code, and can be related to sports, any extracurricular activities, and it depends on the school system what exactly they do. But they may miss meets practice, you know, even a play or a concert or a contest, because of their use. And so you hope that kids think twice about that. And two, that's where we as parents, grandparents, having kids that we are fond of, it's a good idea to check out what happens in their school system, because then you can talk about that to them. And you can even ask the kids, because usually they know that because it's in their school handbook.
yeah, and usually when it comes to especially, you know, high school age in that situation, if it's a kid that's heavily involved in sports or whether, you know, whatever activities, not just sports, but whatever activities, from what I've found throughout the years, is they're usually far more concerned about that than they are the criminal or penalty, because it's usually, like I said, fairly minimal in the juvenile system, or they don't mind paying the fine because maybe unfortunately mom and dad pay it for them. You know, so just being real, they don't pay it anyway. Mom and dad cover it. So what they really care about is what you just talked about, Kathy, and their loss of time in school with whatever activity that is.
And missing being with their friends and hanging out. Yep. All right, a couple more things that we want to talk about. This is called sober curious, and it's a term that was coined by Ruby Warrington. She wrote a book about it, and what it means is that someone has recognized that they would like to be sober. They're curious about it and wonder what it's about. So they may be sober curious for a short time or a lengthy amount of time. And what it means is that they don't drink anymore. They find out, what are other ways I can have fun and still be with my crowd of people and still get thrills and excitement, but I don't have to be hammering down drinks all the time to do that. And there's lots of benefits related to that. No hangover, mental clarity's better, your sleep may improve, your energy changes, your immune system's better, and weight management, reduce depression and anxiety because alcohol is a depressant. And then you got more money because you're not drinking. That's huge. So that's a term that I had not known about. So very interesting, and is something too that, again, you can talk to your friends about and be like, hey, have you ever heard of this? Some beliefs we want to make sure that everyone understands. And sometimes people say, oh, let's just talk to the youth about this. But there are some family systems who may believe some of these beliefs. And it's all related to kind of some things that people over the years have said, oh, you drink black coffee, you know, here, keep drinking coffee, or take you outside, or let's go on a walk. It may help to get some movement, but it's not going to help you get sober quicker. The only thing that helps you get sober quicker is time. It just has to go out of your system. I do want to share a little bit about the one that says eat food. It's not going to help you to become sober, but if you eat either before or during your drinking, it does help with absorption and you don't get drunk as quickly. So you may want to keep that in mind. And some of these are bizarre. I've never heard of drinking milk before you drink. Has anybody heard of that one? I was just like, I don't think the dairy industry would back that one. And then two, putting a penny in your mouth, it's going to lower your blood alcohol content. Dan, have you ever pulled anybody over and they had a penny in their mouth? That's just strange.
Oops, I'm sorry, I didn't realize I was muted. I have always heard of that trick. I can't think of a time when I've had anybody actually try to do it with me, or if they did, I didn't know about it and I didn't see the penny.
Would be pretty hard. Stick your tongue out.
Yeah, yeah.
No, we're not doing that. All right. Okay, and then one thing it's kind of new research. It shows that the less you drink, then you lower your risk of cancer. And this news feature tells us more about the research that was done. And hopefully you will all hear it and see it.
Iowa continues to have the second highest and fastest growing rate of new cancers in our country. That's according to the Iowa Cancer Registry 2024 Cancer Report.
And this year's report was focused heavily on alcohol and its connection to cancer. Reporter Tidora Mintov explains what that report found.
We definitely have more work to do. And this year's report focusing on alcohol was just picking one of those risk factors. Not necessarily the most important risk factor, but one of the important exposures that we as Iowans know that we have and where we're out of line with the rest of the country.
The report concluded that our state ranks 4th in the nation for binge drinking. Iowa is also growing in alcohol-related cancers.
So alcohol itself turns into a carcinogen in our system, and it can damage our DNA. What it does also, though, is it blocks the absorption of nutrients and vitamins that it takes to repair damage to DNA. So it's working in both of those ways, creating damage and preventing damage from being fixed.
And while alcohol isn't the only risk factor, they decided to focus on it because most people don't know that it's a carcinogen. And that information could have helped cancer survivor John Stokes.
I did not really realize when I was drinking Jack Daniels that I was going to lead me to cancer.
He had larynx cancer, one of the cancers that can be caused from alcohol. He says this report can help others.
If you want to live get to be an old man, you have to be lucky like me, or take care of your body, and the decisions you make affect things decades later.
In Iowa City, Tidora Mitov.
All right, and I can say when I first heard this research, I was kind of downright mad because I'm a cancer survivor. I was like, I don't drink. And just remember, the premise of it is the more you drink, the more carcinogens that are in your body and the less ability, like she said, to fight those things off or to be continued help, it interferes with it. So we can't say everybody who has cancer has use too much alcohol. We just need to say the less a person drinks, then you lower your risk of having cancers. So any comments or questions with anything so far? Okay, we've got another fact or fiction. This one should, I'm not going to say. Okay, I was going to say it should be easy, but liquor, wine, or beer may be given to a person under legal age in a private home by a parent or legal guardian who is present. What do y'all think? And I left out folks in the chat.
False online.
False fiction online.
Yep.
Okay. See, we're learning stuff. It is a fact. And I know too, growing up, this was kind of a rumor that this could be legal. And people kind of said, oh yeah, it's okay if my mom and dad give it to me. But this is fairly new in the Iowa code that it is legal. And so we've really gotten into the law here. So now we're going to spend some time visiting with Dan and seeing what kinds of trends you've seen and comment on whatever you'd like to share, Dan.
Keep forgetting to do that mute thing. I think a lot of the trends I've seen are a lot of what you've been hitting on. I think you mentioned earlier that that underage drinking has gone down. I always caution on, and that is what we're seeing, but at the same time, I always caution. It's kind of like when people ask me, what's going on with drugs or what's going on with alcohol. the problem is with that is we only know what we know, and we don't know what we don't know. So is it a fact that probably that we're responding to less of that and less people are getting charged? Absolutely. But what we don't know is how many people are doing it and not getting caught. Are they just getting more, I wouldn't say smarter, but more clever about how they're doing it? You know, maybe it's a host of things, but the truth, like you said, Kathy, we definitely are seeing way, I mean, it's significantly down, significantly from years ago. Does that equate to kids are doing it less, or are they doing it differently? That's the $1 million question that I'm not sure about on that. And definitely alternative drinks have gotten to be the new latest and greatest, or the tumblers that have gotten so popular, you know, especially in this area anyway, everybody has their tumbler cup. And like you said, Kathy, you know, mixing it with vodka, that's a big mix of choice. And it's the alternative drinks. I would say drinking beer has definitely way down in the younger group. You don't see a lot of beer drinking, and you know, I don't know in this day and age what's politically correct and what's not anymore, but we're definitely seeing, probably especially in females, you're not seeing them drink the beer that we used to. They're drinking the alternative mixed drinks, or they're putting it in the tumbler. And you know, I'm painting it with a wide brush, but I'm just telling you that's generally what we're seeing in general. Of course, there are, you know, you can poke holes in that and individual circumstances, but I'm saying in general. As far as older crowd goes, you know, I probably alternative drinks are still popular, but I think then it comes to craft beer, you know, you kind of got that crowd that likes their craft beer, and they like it a lot. They spend a lot of money for it. They drive a long ways to go get it. And that crowd tends to be more of I'll call it a day drinking group. The craft beer, you know, for one, the breweries aren't open late at night. So we're seeing a lot of day drinking in Winneshiek County. And then you have what's left, more your traditional that we've seen in years past, more your traditional domestic beers. And, you know, there's probably not a lot to say on that, just probably more what we've seen in years past. But like I always, you know, even with governor's traffic safety programs and statewide initiatives and things like that, they always in their regulations or their rules and whatever to join these programs, they always want us to put extra enforcement out at 2-3 o'clock in the morning. And my opinion, that's out of touch. It's out of touch with Winneshiek County anyway. I can't speak to the rest of the state. You know, I don't work there, but I do lead Winneshiek County, and that's out of touch. It's not realistic. I tell them, if you want to hit when the majority of the people are drinking in Winneshiek County, hit it from noon to 8 o'clock at night. By 3 o'clock in the morning, I'm not saying there aren't people driving drunk and drinking. Of course, that's not true, but I'm saying it's not even close to the masses. The masses are doing it during the afternoon in that happy hour. So, I guess that's what I think. Drunk driving's down. Again, I do think that trend's probably, again, I only know what I know, but that's a fact. That one I think is fairly, I think those stats for sure in that one are pretty accurate. I think drunk driving's definitely down. Obviously, one drunk driver is too many. I'm not saying we're in an okay spot. I'm just saying it's down from what it was. Now, in fairness, that maybe isn't to put that in perspective, down from what it was maybe isn't that good, because it used to be super high. So it's all matter where you start. But I do think that's significantly down. People are planning their outings a little more. There is more designated drivers, obviously still going on. I'm not saying that, but it's down. So there was one question I saw pop up on the screen. Was it about CBD infused drinks?
Yeah, just
So
ask if there's any info about the new CBD infused drinks.
I don't have a lot on that. We haven't dealt with that a whole lot. or if they are doing it, it either, I'll say one of two things, it either hasn't been problematic or we haven't been detecting it. And again, I'll be humble about that maybe we're missing it too. There is always that possibility. But I don't have a lot of info on that, or at least anything that's kind of risen to the surface. I do think part of, though, I'll maybe tackle that from a little different angle, and hopefully people don't think I'm dodging the question, but I do think some of the reduction in underage drinking, or at least what appears to be a reduction in underage drinking, has largely been replaced with vaping and THC vaping. That part I'm pretty concerned. I'm pretty sure about. As far as the CBD infused drinks, I'm a little less confident in that one. I don't know.
Have a Oops,
Go
And I
ahead,
was
Cindy.
going to add to that too, that certainly the research that we've seen related to youth using vaping and CBD, using it in that way as well as substantiated by the Iowa Youth Survey and some other sources as well.
Yeah.
Was there something else somebody wanted to share?
Yeah, it's me again, Cindy. This is for Dan. So I just am curious. So if you pull someone over and they're charged with drunk driving, does that reflect in the Winneshiek's numbers, even though they may come from Wisconsin? So does that distort our numbers if that's the case? I'm just curious.
I don't know how the numbers are collected by the state, but I can tell you how we report them. And so so it's my little disclaimer, but now I'll follow up by saying I'm quite certain I'm accurate on this. I think it doesn't matter where they're from. Crime statistics are kept by where it occurs. Doesn't matter where anybody's from. So assuming they're following the standard of crime statistics, and I am assuming, so I'll fully admit that, but I can tell you how crime statistics are calculated. And if they're following that, then I can answer the question accurately. And crime statistics all go by where it occurred. It makes no difference where the person is from.
Okay, so the more breweries we have and stuff, and microbreweries, the higher the number, right?
Absolutely. And I see your point, and you raise a good point that are people in Winneshiek County, meaning Winneshiek County citizens, drinking more, or are people drinking more in Winneshiek County?
Correct.
And that's a fair distinction that I hadn't directly considered till you brought it up, but I don't argue with you. I see where you're going with that. And you make a good point. And the short answer, unless somebody calls foul on me and I'm wrong, is it doesn't matter if we're getting people from Illinois, Wisconsin, or Canada or Switzerland. I mean, if it happens here, it's going into our statistics. So
I do want to just butt in really quick about the CBD infused drinks. I do have one here that we had bought for Healthy Delaware County, so I thought I would show you guys. It is Climbing Kites. It might be a little hard to see. This was purchased in Fayette. And then our last Healthy Delaware County meeting, somebody had known of it to be a Fairway even. So I just thought I'd share with you guys what it looks like. This is the CBD infused drink. And then just to kind of piggyback off of what Kathy had mentioned about Sober Curious, and to kind of get you guys at an angle from like the TikTok trend side of it, people were using the word sober curious, but while they were doing that, they were replacing alcohol with things such as the CBD infused drinks, or there's other ones out there online. So although they may sometimes be actually sticking to the no drinking and doing things that are healthier for their body, some of them took it as, oh, well, I'm not drinking alcohol, but where else can I get that high or get that feeling? And so they were on TikTok anyway, turning to these other products. So I just thought I'd kind of touch base and share a little bit more on that one. Although it can be a good thing, you never know what they're turning to still get that feeling. So that was all I had to add.
to Sam's point there, it's getting to be, at least, and maybe I'm just getting old. That's the other thing too. I'm probably just getting to be an old guy in the industry, but she held up that can that you held up, Sam, and it used to be where if somebody had a open container, you looked at it and you knew if it was alcohol. Heck, I'm to the point, and maybe the young people know this more, but I'm to the point I darn near have to take the can and read the ingredient label. I don't know what's what anymore. All these cans, there's so many drinks out there. Geez, it used to be you had a few different kinds of beer and you knew what a beer can looked like or it wasn't. Now it's a totally different game out there. And, I feel like grandpa out there having to put on my bifocals and read the can to figure out what the kids are even drinking anymore.
Sam, would you mind showing that that thing again? I'm not sure if we can.
Yeah, I'll chat real quick. Climbing kites there. It's colorful. They had 4 different flavors sold there. And when I had walked in, I don't know if many of you are familiar, I guess, with the gas station there in Fayette, but there's like a food section, kind of like a Subway setup, and the whole front section was boxes piled high. And then there was a little cooler that they kept milk in, and this was also next to the milk. So it was in 2 different places. And I think I went pretty close to when it was new. And so people were shocked. Oh, did somebody buy the climbing kites? And I was in line and oddly wearing my Healthy Delaware County sweatshirt. So I felt a little odd buying it, but it's a sparkling water and it's got 10 milligrams of THC and 20 milligrams of CBD. And then it says at the bottom, 0% alcohol. So yeah.
Thank you. I couldn't get the screen to work here live so they could see that. So thanks for repeating that. All right, now we're gonna go back, and Sam just talked about a coalition that she's part of, Healthy Delaware County, and in each of the counties that we serve, there is a coalition in the county. And so this is the piece that I want to make sure everybody gets, where your coalition is at in your county. And many of them meet around the lunch hour, but that's not true of Fayette County. And my cursor thing is not wanting to work too well. So hopefully, there we go. Fayette County meets a little bit later in the day. And so we want to make sure that you get that information. I'm going to try to back up because there was a piece that I did not get to. Thinking about what we can do in our community. One thing that's very important is to talk to our people who make laws and impact ordinances in our city and towns, to educate them on if it's easy to get here, particularly for youth, then there's going to be a concern. So if there are a convenience store and 4 bars and a brewery all in one place, that makes it more accessible and youth can get at it more. So that's a concern, and it's shown time and time again that there's more access. The crime rate goes up in that area and lots of other things. So those are things to let those lawmakers know, that access is vital. Another thing is to advocate for ways for youth to learn to cope in healthier ways. So our schools, our families can promote positivity and positive things to do and healthy coping skills. And certainly we want to role model that too. And then there's where we jump into the joining a substance abuse prevention coalition. And many of the coalitions go beyond just talking about alcohol. They also talk about vaping and some of the other drugs we've visited about. And some of them too have mental health components too, because they're all connected. So we want to make sure that you get that information for the county that you're in. Some other things too, yes.
Question for Dan. With all of these different kind of beverages, the fruities and the, going away from the beer and more of the hard liquors that you talked about. Do you see this showing up more in the workplace, in accidents, that kind of thing?
That's a great question, and I wouldn't be able to back that up to say yes. But I'll also come back to a lot of times like workplace accidents and things like that, if they're happen in the workplace, a lot of times they're handled internally and we don't always know about it. And I'm not taking a shot at workplaces by any means. I just think a lot of times a lot of this new stuff goes undetected. So I don't think it's getting into the stats or the awareness, not because it's not happening, because it's not getting detected. But I think you bring up a great point, but I'm always hesitant to answer in the affirmative to something if I can't back it up. And I don't know that I'd be able to back that up to say yes for sure, but my gut would say you're probably not far off.
I didn't know if you were seeing more accident trends, that kind of thing, if that's showing up.
We haven't really, no. I mean, not that I would be able, I can't say we have seen a lot of that, no.
Thank you.
And there's a
Yep.
question in the chat for you, Dan. Do breweries have a lower rate of getting charged for serving underage drinkers?
I can say we have not been called to the breweries for serving underage. There are regular compliance checks that are required for their alcohol license and their dram shop insurance and all that kind of thing. And I will say that in all the compliance checks that are done per state regulations, we have not had any issues with the breweries. Now, are they good at passing compliance checks, or are they minding their P's and Q's all the time? But I would say the short answer is yes, they probably, well, I wouldn't say yes. I wouldn't say they're not being charged as much. From what we can tell, they're not violating as much. As far as do they get a break over anywhere else? No, it's not enforced any differently, but we're not seeing, but we are seeing we're not seeing the violations at the breweries that we are seeing at some of the bars. We are seeing a definite difference in what is being reported to us and what we're responding to. And the reality is that we do usually, a lot of our enforcement does come down to what's reported and what's not. You know, if it's not reported, oftentimes we don't know about it.
Great. Okay, I think we're gonna go back to the slideshow here and get through a few more. I'm so glad that people are asking questions. We're gonna kind of skip this slide if my cursor goes okay. Oh yeah, it did. How can we help those we care for? Your Life Iowa is a wonderful resource. They have a website. You can call, you can text, you can get lots of good information from them. Remember too that when you talk to someone that you care about, do it from a sense of caring versus a lecture or something like that. Your Life Iowa also has a facility locator, and you can find the different mental health resources and treatment centers. And then to be that role model again, like I said earlier, to celebrate, adults can celebrate with alcohol and be healthy and happy, but it also can go sideways. So you want to be a good role model and show different ways that are healthy coping skills, like hunting or fishing or riding your bike, whatever. Do those things and role model those. We are running short on time. We're gonna skip over this. I'd love to do it, but it's really 7:30 right now. Want you to think about maybe on your way home or after you get off of this, you can have a conversation with someone that's near you about when you started drinking and what your parents' rules were related to that. May give you some insight into some of the situations and thoughts that some of our youth are having. There are some warning signs for underage drinking, and they are here on the screen. Some of them I just want to give a disclaimer to. Mood changes and rebellion are part of teenage land. So you don't want to go, oh no, there's a problem. But Keep in mind too that you can physically find items perhaps in their room or smell it on their breath or loss of concentration or problems at school that it may add up to some concern. Very quickly, this is a framework for talking with youth, and start off with a simple statement to just kind of say, hey, I heard about this. What do you think? Identify an emotion, and particularly one that you think that the youth may be having. Reiterate a truth. I'm afraid that alcohol's harms could get in the way of your dreams. Follow up by asking, what can I do to support you to be healthy and safe? And when you want to talk, I'm here. And that's the big thing. There's two big takeaways from this you want to do. One is you are a person who is approachable to a youth. And secondly, listen, listen, and listen. Somebody once said to me, you know, you have two ears and one mouth. Good tip.
Hey,
Okay,
Kathy.
now is the time that we want you to do your evaluation. Sam is going to throw the link into the chat so you can click on that. You also may want to grab your phone and grab this QR code. For people in the room, it's the yellow sheet that you have before you. And really quickly do this evaluation so that we get some feedback from you. And Sam and I, Sam said this is the last training of our fiscal year. We've done 8 of these this year, plus some Your Life Iowa trainings as well. And we kind of want to get a feel from you. Do you like having the option of being in person? Do you like the idea of you can do it on Zoom? Do you like the idea of having one at noon and one at 6:30? What do you enjoy, and what did you like about tonight? And what did you learn from tonight? And as you're doing that, I'm quickly going to talk about an event that's happening in Waukon June 5th. It is called Coming Together for Change, and it's highlighting awareness related to domestic violence, mental health, and substance use. And it is from 7 to 9 at the Town Theater in Waukon. And really encourage folks to go to that, to get some conversation going. They have a panel of experts, law enforcement, mental health professionals, domestic violence professionals, substance abuse folks, and they'll have a really great presentation and lots of insights, just like how we learned insights from Dan. We're going to learn some of those too for that evening. So please go ahead and do your evaluation. There's the information for the Coming Together for Change. And lastly, I will say this is the last training of my career. And Sam and I can attest to that we put a lot of time and energy into creating these presentations and making them applicable. That isn't, you know what I mean, that you can use it. And we've enjoyed it, but it is a lot of work. And we truly appreciate everyone that's here and that has, if you're a newbie and you haven't been to a training, hooray. And if you're a person that comes to every one, I think there's a few people that are on the call tonight that have been to almost every one of our trainings in the past. So we really appreciate that. But I thank you, Dan, too, for being with me in this momentous occasion.
Well, Kathy, I want to wish you nothing but the best in retirement. And when you asked me to partner with you in this last training, there's, oh, what happened here? Okay, when you asked me to partner with you in this last training, there was no way I was going to turn you down, not after a 31-year career. So congratulations on a job well done, and enjoy your retirement and all the cool things that go with it. You've earned it.
Yep. And I hope that I see you socially and not in my rearview mirror.
Me too.
Yes, yes.
Hey, Kathy, I do need to sign off. Work has been calling my phone for about the last 20 minutes and I've been clicking out of it. So I got to see what they need, but wish you the best and thank you all and have a great summer. And Kathy, I hope to see you at your retirement party.
Yep, sounds good. And if people do have questions or comments that they want to make, and they want answers to, Dan will get those to you. And people can sign off too at this point because we are a little bit over our hour.